Welcome, and thank you for watching my video on internet use for health-related information. After watching the assigned videos and comparing the data to my own, I found some interesting contrasts and some interesting correlations. First thing I would like to discuss is the e-patient revolution that was published by Crew Research. The researchers noted that the age of paternalistic medicine is ending, and that 83% of people are searching for medical information online, and 57% of them are sharing that information with others, including family members, doctors, and colleagues. As you can see from the following graph, my data does not correlate to the same findings as Crew Research. Based on my patient population, which was my immediate family only, 60% of them had ever truly searched for anything online, and they certainly didn't feel it was necessary to share it, as their belief was that the physician would truly know best. Also, my focus group had little to no idea as to what would be reputable versus not reputable. It seemed as though they felt that it was just safer in general not to use internet-based information, as once again, they felt that the doctor was the main source of information. Next to discuss would be Pew Research. One thing I noted from their research study was that they found that over 50% of people use the internet for social media. I found that, interestingly enough, my male population was older and none of them used social media, but my female population was younger, and every female under the age of 30 had used the internet for social media. Please see the next graph to see the differences between my findings and Pew Research. This brings me to an interesting correlation between the past two studies. The e-patient revolution also mentioned how patients are using the internet to find support groups and communities related to their chronic illnesses. Social media is that outlet. It is a place where anyone can go from any walk of life and find someone who understands their struggles and shares in their journey. I can honestly say that if social media did anything good, it was being able to bring hurting people together to support one another. While reviewing the National eHealth Collaborative results, the one area that I had noticed of interest was the patient-consumer engagement. Their findings were at 95%. As you see on my graph, my focus group stated at 100%. And although my focus group seems uninvolved in their care, they all stated that they were 100% involved in the decision-making and felt like active participants in their care. This is where I question what my focus group truly means when they say that they are involved. I can imagine that they have questioned a prescription, but I'm not sure that they have ever questioned the diagnosis. Lastly, and definitely not least, I truly enjoyed the Health IT for You video, and I am actually planning on sharing this with my family. I thought that the Health IT video was very informative and broke down what Health IT really is and how it can be beneficial to not only have access and share your medical information when needed, but that multiple sources can see the same information. This allows you and your family to be active parts of managing your chronic diseases and allows you to create a shared plan with your caretakers. What I would lastly like to bring up is that one area I should have taken into consideration from the beginning. When we do these types of surveys and look for information, it is imperative that we take into consideration the cultural norms for the focus group in which we are interviewing. My family is not all from the United States, and most still believe in a more paternalistic style of medicine, meaning that they have full faith in their physicians and have no need to question or feel the need to question his or her authority. I hope that my education and my knowledge can help them move forward into the next century of health IT so that they can be active participants in their care and use the internet wisely so they can find evidence-based information to keep them healthy. Thank you very much for watching.